worry.
We're back in
Yes.
conversation with Dr. Maronga of the Lions Sight First Eye Hospital as we celebrate this World Oral Health Day. And we were in conversation about what we can do for our oral health, what common diseases are there, and then also let's find out what practitioners can do. What's the role of oral health practitioners? And I remember I was even asking Daktari just off air, just before we got on air, how dentists fall into this whole like health strike that we're seeing, right? Because like it's not very often that we see dentists participating either in the strikes or even in public hospitals, to be honest.
So I think the reasoning, so dentists are there in public hospitals, but mainly also in private hospitals. So the reason why you don't see them, I think, like if you look at the ratio of medical doctors to dentists, for every like 10 or 15 medical doctors, you will have one dentist.
Wow.
So I think that dilution effect is the reason why you might not see them. But yes, they are doctors. They are also part of the Kenya Medical Practitioners and Dentists Union.
Yes.
And dentists are there in public hospitals, in private hospitals, and even in teaching institutions as well.
So what role do, of course, now dental health practitioners play in making sure that, the nation is healthy, has a happy mouth?
Yes, so that's a good question. So the first thing that we do is to give oral health education. And that's what we are doing, and that applies to what dentists do, and also even the other cadres, like what Mama Brian was doing, teaching them how to floss. So there is that role of educating the public. So part of the education we give is what we have given you about how to take good care of your health. The other thing that I must mention is the role that the contaminated groundwater plays in making your teeth brown. Now more and more we are seeing a lot of people having brown teeth. If Brian was growing in Nairobi now, not that time, I can see he has very nice teeth.
Thanks.
If it was that time,
kuanzia leo sijui mtakaa wapi.
Tukutafute ad ya nini?
A dentist has told me that mimi mtafute pale penye mtakaa after show.
Utalala na viatu.
Nitalala na viatu.
So there is the role of groundwater, like we are using a lot of borehole water, so we are seeing teeth being very brown. So we are educating parents that if you are expecting to be pregnant up to the time the children are 10 or 12 years of age, you need to make sure that the fluoride levels in your water is well controlled. The other thing that dentists play is the role that we play is checkups. When you come, we are going to look at your teeth. A lot of people are always scared to go to the dentist, but you can actually come to the dentist and you get a clean bill of health. We tell you your teeth are clean. Whatever you are doing, continue doing it. But if there is something
bado tutawalipa hiyo maneno ya motivation.
Consultation lazima utumotivate.
Umeita motivation.
Hiyo ni motivation, endelea kusugua meno.
And sometimes you might find something, maybe a tooth is starting to have a cavity or the gum is not healthy, then we are able to intervene early. Because part of the things that people really think is that dentistry is expensive. And you may have heard this saying that dentistry is not expensive, it is neglect that is actually expensive.
I like that one.
If you come to me and you have a small cavity, maybe it's going to cost like 5 or depending on where you are, 5 or 8,000 shillings to have a filling done. But if you avoid coming and you come at the tail end, unless you are ready to lose that tooth, or if you say I want to keep that tooth, a root canal treatment will cost about 20,000 shillings. And you'll get that even if you did a root canal treatment for that tooth without placing a crown on that tooth, then it's at the risk of actually fracturing. So then you are going to do a crown, and a crown will cost anything in the range of 20,000, 30,000. So you are looking at 50,000 already to save one tooth. Which then now it's almost someone's salary for the whole month, you know. But if you came early, the filling would have cost like 10% or 15% of that.